Jan, thank you for teaching the dry needling course this weekend. I learned a lot.
Yep.
I have a couple questions for new grads. My page is mostly dedicated to new grad physical therapists.
Yep.
My first question would be, what's your piece of advice in general for new grads starting in this profession?
Ooh, that's a loaded question, Emily. I have a few things of advice maybe. I think one, don't be tempted by large box physical therapy clinics that are owned by private equity firms. They will probably send you huge incentives your way, bonuses, sign-up bonuses, $15,000, $20,000. I know many new graduates have enormous debt from PT school, but the problem is, if you look at the statistics, many people who start as a new PT work for these big companies where the main objective is to make money so that at some point the private equity firm can sell the business again. Many of them leave the profession after a year and a half, 2 years that they need to do. So more importantly than getting your money back as soon as possible, paying off your debt, which I understand is a big problem. I totally acknowledge that. I think more importantly is to find good mentors who are interested in you as an individual, as a growing professional, as a young professional, to really become really good at what you do. I've been a physical therapist almost 40 years, and I have no signs of burnout. I am devastated by the fact that so many new graduates after 2 years leave the profession. I think it has a lot to do with the choice of where you start working. So get a good mentor, get a clinic where they're willing to invest in you, where they're willing to support your growth, your professional growth, your skills, your education. Continuing education budget should be existing and not be waived. So be more critical. Don't think you need to accept every job that comes your way. There's a shortage of physical therapists. So if you enter the market, you have a lot more to say than you may assume you do. And I think that's probably my biggest advice I can give to new graduates.
That's great advice. Who would you say was a mentor for you when you were first starting?
Oh, I have a lot of mentors. The issue with mentors is you need to recognize, usually in retrospect, that they were mentors. Because sometimes you just work with people and it's really great and good and like, wow, that person made such a difference in my life in retrospect. In my case, I really realized that later. When I speak at a conference, my last slide is always a tribute to my mentors. Janet Travell, who puts me on the track of myofascial pain and eventually dry needling. David Simons, who is the co-author of the book of Travell and Simons. And I have another mentor is Richard Madison, Dick Madison, who was the medical director of the National Rehabilitation Institute, National Rehabilitation Hospital, in Washington, D.C. He was my boss. I worked directly for the medical director of the hospital in an administrative function. But one day I got a call from his assistant. He said, "Oh, this weekend you need to keep open because you're speaking at this conference." At the conference of the American Academy of Occupational Health, I think, or something like that. And I was like, "Oh, you must have the wrong person because I don't speak at conferences." I had never spoken at a conference before. He said, "No, I'm pretty sure he wants you to do that." It's like, "No, I don't do that. I don't know how to do that." Yes, he did want me to speak at the conference, and I was very nervous. I'd never done that. Occupational health doctors, what do I know about occupational health? So that was a huge impact because after that lecture, I was packed in between really well-known speakers I had taken courses from, and like, I can't believe I'm on the same podium with these well-known people. And at the end of it, I'm like, oh, that actually went much better than I thought. The reviews were fabulous. It's like, oh, I can do that. That was a true mentor. He said, like, no, I believe you can do this. Go do it. Stop complaining. Just do it. So Dick Madison had a big say in how I eventually developed myopain seminars. I speak at a lot of conferences, and I honestly don't care how many people are in the audience. It makes no difference. I am not nervous. I know how to make slides now. At first lecture, my slides were awful. They were made by the hospital. I said, okay, I made right there a decision. I will never, ever let anyone else make my slides. I need to be responsible. I speak at so many conferences now all over the world but that started with that decision to put me on the schedule. So there's several other mentors, many of them in the dry needling realm. Peter Baldry. He was a British physician. He introduced me to superficial dry needling. He spent a bit of time in our clinic, learned from him directly. Chen Gan is another one, is a Canadian physician who introduced me to a different form of dry needling when I was really just starting out in that. So there's a lot of people who are mentors. In the end, all your patients are really your mentors.
It's so true, and I think that's what I highlight a lot on my page as well, is not only am I being a mentor and a teacher to them, healing them with their pain, being able to look to my patients for life advice, especially as a young clinician. I find that a lot of mentors come from not only my other clinicians, but my patients as well. And now, of course, with your mentors, you're a very skillful speaker and storyteller with these courses and around the world. And I guess my next question would be, people that attend your courses, how are you indirectly mentoring them for life outside of dry needling or outside of clinical skills?
Wow, you have difficult questions. When I teach, or people in my company teach dry needling, I think we typically emphasize that it's not so much the trick of dry needling that's important. Dry needling itself is not that difficult to learn. It's really not that hard. You need to know anatomy, clearly. You need to know, it's totally anatomy driven to some extent. But what we always try to convey is more of a thought process, like, okay, how can you clinically help your skills as far as what you're gonna do? Like figuring out what's wrong with the patient, whether dry needling fits into that. But the dry needling is probably not the most important part. It's more like come up with a reasonable framework that you can interact with people. In this course, I talked about the importance of a therapeutic alliance. That comes before you decide to do dry needling. If you have no alliance with your patient, pretty much everything falls apart. If you have a therapeutic alliance with your patient, that you should take time for that. You should be able to say, all right, tell me your story. What do you have to say? Why are you here? If it's a simple tennis elbow, that story can be very short. Hey, I picked up a heavy bag, I was traveling, oh my gosh, I felt this pop on my elbow. That's probably the end of the story. But if you see people who've had pain for much longer, my average patient has seen 14 other physical therapists.
Wow.
And which is very sad. Yes, wow is correct, but it's very sad. Like, why did these other physical therapists not figure out what was going on? And so therapeutic alliance, I think, is where everything starts. If you can make an alliance with your patient, that people really trust you, who you are as a person, that you're genuinely interested in what they have to say, I think that should be the start for any new graduate. Don't be too worried about your skills. Don't be too worried, like, oh my God, do I know enough? I remember vividly when I first had a patient in my schedule who was a physician. It's like, oh my gosh, what am I going to do? They know so much more than I do. And within 10 minutes, I realized, no, they know a lot about what they know. I know a lot about what I know, even as a fairly new graduate. No, I'm not intimidated by physicians because they clearly come to me because they don't know what to do themselves. So trust your own skills. Any new graduate has a phenomenal education from your DPT in physical therapy, trained in the United States, but even in other countries, many schools of physical therapy are really good if they're regulated and all that. Some countries that's not quite as regulated, and there's really good schools and not so good schools, but in the US, they all need to meet certain requirements. So you have a lot of skills, so trust your own skills that you know what to do. Create a framework in which you work. Don't just randomly do things, but put some system in, put some order in how you're going to do an evaluation. What are the questions you want? Once you see people, and let's say they have chronic headaches, and you try to do whatever, whether you're trying needling or not, that doesn't really matter. I tend not to ask next time, how's your pain? Because focus on pain should not be the focus of what you do. You should be focusing as a physical therapist. You should be focused on function and happiness and the quality of life. So my question may be to you, if you're my patient. So Emily, what did you do for fun this weekend? Now we talked last week that you really have a hard time sitting in a movie theater because you're low back or whatever. Now you're a little better. What movie did you see? Was it worth watching? And the patient says, I didn't go to the movies. I didn't do it. And then you have something to talk about. Like, why not? You are able to do that. You should really get your act together and enjoy life again. Rather than, tell me on a scale from 0 to 10, what was your level of pain?
Because then you're honed in on the pain.
If you
rather
keep
than
focusing on the
enjoyment.
pain, you're pushing people into disability rather than ability.
Right.
And as a therapist, if you have proper therapeutic alliance, like a relationship with your patient, within that context, and not beyond that, I don't socialize with my patients outside my work. As a general rule, some people I know because I know them socially as well, but that's different. Typically, when patients invite me to major events in their life, I usually decline. That's not my role in your life. I'm not your best friend. I'm your physical therapist, and I will help you so that you can have major events in your life. But I don't necessarily have to be part of that. You know, there's a difference. So for new graduates, trust your skills, trust your knowledge. Keep educating yourself. Also know what you don't know.
And
If
it's okay to admit when
Oh,
you don't
that's
know
it.
something, especially to your patients, right?
It's very important that you acknowledge that, but don't leave it with that.
Right.
So I see a lot of people with Ehlers-Danlos syndrome. It takes them 10, 12 years before they get diagnosed. And most of them have a similar story. They were dismissed. There's nothing wrong with you. I have a patient that saw 5 specialists, clinical pediatric specialists. They all said there was nothing wrong with you. And if I would show you how she walked, you'd be shocked. She could barely walk, and she was incontinent at age 14. Like, how can any doctor say there's nothing wrong with you? You're incontinent. Which 14-year-old girl chooses to be incontinent? And she had a major problem that I was able to identify. She had anterior brainstem compression, needed cervical surgery. She's now an actress in Atlanta. She has a full life. She's very committed. She's happy. She's doing what she's fulfilling her dream. 5 doctors said there's nothing wrong with you. She was lucky because she and her mom and her dad did not believe that, and I saw her a month and a half after it started. So the damage was not so bad, but no permanent damage. She's doing great. If I had done what everything else wants to do, oh, there's nothing wrong with you. These doctors said, oh, your dad is not home enough, you just want attention. That's why you may act like this. You're just acting out. I don't know any 14-year-old who would act out by a normal kid that grows up, that's active in theater, active in school, active in music. Why in the world would that kid become incontinent on demand? That makes no sense at all. But in another scenario where the parents did not have these opportunities, highly educated parents, highly educated kid, many of our patients do not fall in that category, and they go on for years. Well, if she had gone on for years, she'd be permanently in a wheelchair because there would be so much damage to the brainstem. And that's just one out of many patients. So if you don't know, just acknowledge, that's a really interesting question. Not sure I know the answer right now, but let me get back to you on that. Do your homework. You know what PubMed is. You can find articles. You have probably your own mentors, more senior therapists in your clinics. Maybe your professor from PT school that you know had a special interest in that. Ring up that person, send that person an email. It's like, hey, you told me you were interested in this field. I have this patient now. Where do I go with this? Next time with the patient, or send the patient emails like, oh, I've got some good news for you. When you come back next time, let's sit down and talk about it. So be genuinely interested and don't send people home like because you don't know. Don't tell them that pain is not real. How do you know what real pain is? If this pain is not real, is there such a thing as unreal pain? No, of course not. Pain is whatever your patient says it is. Take it serious, accept it, and then take it from there. But don't give up. Don't send people over, oh, you're making it up. It's all in your head.
Yeah. You're saying to really lean in and get curious when you don't know
Always
something.
be curious.
Always.
Always be curious and use it to the best advantage of your patients so that you actually can become a therapeutic ally to them.
That's great advice.
Yeah, so.
I'm taking the next course in August.
Uh-huh.
What would be your advice for me or for anyone else taking one of these courses? How can they stand out in the class, or what's something that you look for in a clinician that comes to these things? What can you do to get the most out of the class as a student?
We give all the students some videos, PowerPoint lectures. I would review those. So by the time the instructor reviews those lectures, they're like, yeah, I already knew that. Yeah, confirmation. If you have questions, that's the time to ask them. So be engaged. If you live in a state, and you do, and you have, I think, permission from your employer to maybe do something with dry needling now, start needling right away. apply what you've learned, not just the needling, but also the thought process. If you have someone plantar fasciitis, maybe you should say, well, maybe it's not plantar fasciitis, because we covered that many times it's calf muscles. People have a diagnosis of trochlear bursitis. Well, is that really true, or is it maybe referred
You know,
pain
a little
from?
bit more about the bursa,
Yeah.
the hypothetical bursa.
Yeah,
you know,
that you would
yeah.
not think that you would learn that in a dry needling course, but it is part of what you should do, because your quadratus lumborum get pain there, your vastus lateralis get pain, your gluteal muscles get pain there. So maybe apply that knowledge and start going with it. So the next course you take, you already know some of these basic principles, which will not change. We're just going to expand on them. In the next course, you learn muscles that ideally you have some experience already with dry needling, because they're maybe a little bit riskier. The risk of a significant adverse event is 0.04%. So nothing is super dangerous, but you need to really know what you're doing. If you noticed in this course that your anatomy knowledge is failing a little bit, like, oh, I didn't know that.
Definitely will need to brush up on it.
So
There's a
that
couple
would-
muscles.
Yeah, that would be a good, not the bizarre ones like articularis, no one knows about that muscle. But the next course involves all the muscles in the trunk. So maybe you should do a little bit of homework ahead of time. It's like, okay, let's go over the anatomy of those muscles. How thick are they? How deep are they? How close am I to the pleura? What if I want to really avoid? We covered that in the course. The more you do up front, the more informed you are, the safer you're going to be.
To sum up
Yeah.
what dry needling means to you in one sentence, what is that?
Dry needling is the quickest method available to me to change people's lives within seconds.
That's really powerful. In seconds.
Seconds. Not minutes, seconds.
Amazing. Thank you so much. I can't wait to learn more.
Very welcome.
Thank you so much.
Thank you.